In the midst of over 1 million Americans getting ready to lose health coverage and millions more experiencing hikes in premiums due to insurers pulling out of the Obamacare market, Obama spoke in Florida this week and blamed Republicans, insurance companies, and employers for the problems with the law rather than the law itself. "I had nothing to do with that," he told listeners. He lamented that healthcare is complicated and that smaller state markets were suffering due to a lack of competition among private insurers, which he said could be fixed by creating more government plans because it's not like government chokes out private competition or destroys markets with overregulation or anything. Several states have already reported that they will see premium increases of 50% and higher across the board. Because government did that. The price increases are approved by state regulators, and the approved increases are actually higher than those requested by the insurance companies. Why? To try and keep insurance companies from leaving the exchanges, companies who are leaving after reporting multi-million-dollar losses. In Florida's pre-Obamacare days, the state had 18 insurance companies to choose from. Next year, Florida will have only 5. 6 major insurers will also be leaving the Arizona market in 2017, leaving most residents without a choice for insurance. In fact, only 1 county in the entire state will have 2 insurers to choose from. An average 40-year-old non-smoker in Arizona can now be expected to pay nearly $500 a month for insurance, while an average couple with 2 children is looking at $1,400 a month. Blue Cross of New Mexico is raising their rates by 83%, and Crystal Run in New York is raising premiums by 80%. Michigan, Minnesota, California, Oklahoma, and Tennessee are all reporting similar problems, and those are only the states that we know about so far. According to USA Today, only 8 states are expected to see increases under 10%, but some of those states haven't actually approved the new rates yet, and those numbers don't account for new plans entering the marketplace. Deductibles have gone up as well, with 41 states getting a hike in 2016. In Florida, the average deductible has increased by almost $1,000. Officials say the price and deductible hikes are because the plans were all originally underpriced. So you mean to tell me that every insurance company in the country was previously underpriced? The insurance companies claim the rate increases are because of the uncertainty of ever-changing regulations around healthcare, but Obama says he and Obamacare have nothing to do with that. Several states are in danger of having their healthcare markets completely collapse, and Minnesota has declared its healthcare system in a state of emergency, and Obama is blaming Republicans for not signing enough people up or working together to create better subsidies. Nationally, 84% of enrollees get subsidies, which have to come from somewhere, and in 2015, half of the people who had received subsidies were given the wrong subsidy and ended up owing money to the government. And this wasn't just a few bucks. The average bill was $800. In fact, according to a report by the Kaiser Family Foundation, only 4% of Americans received the correct subsidy. But, again, government has nothing to do with this. In Obama's speech, he compared the Affordable Care Act to exploding smartphones, saying if your phone has some bugs, you fix it, rather than repealing it completely. The reference was obviously to Samsung's Note 7, which was recalled and fixed, continued to catch fire, and then was discontinued completely. I mean, the thing is banned from airplanes. The company has recalled the entirety of Note 7s, admitting defeat, losing billions of dollars, and accepting that customers are going to have to choose from their competitors. So the metaphor is an actually accurate one, though not the way that Obama intended. Throughout the life of the ACA, Obama has been unable or perhaps unwilling to understand that his way is not the only way, and competitors, like the private market, may offer better alternatives.